Now turns to Part 4.
Part 4.
You'll hear a lecture on sports injuries. First, you have some time to look at questions 31 to 40. Now listen to the lecture carefully and answer questions 31 to 40.
Morning everyone, and welcome to our regular lecture on health issues. This series of lectures is organised by the Students' Union. It's a great pleasure for me to welcome Mr. David Greenbaum, a physician in sports medicine, to come along and talk to us today.
Thank you. You may doubt what good sports medicine can do to non-athletes like you college students. According to public assumptions, sports medicine doctors deal only with sporting injuries. But actually, we treat general joint problems experienced by average people more than treating people who hurt themselves by playing sports. So, whether you're an athlete or not, a sports medicine physician can help you start off every day on the right foot. If you are a college athlete or a sporty person, you must stay at the top of your game. But how do you maintain best physical fitness? You should be under the watchful eye of your sports team physician. Sports medicine doctors offer total care treatment, such as customized workouts, immediate care of injuries, and surgery when needed. A sports medicine doctor's training falls within the specialty of orthopedic surgery. As such, it focuses on the cartilage, ligaments, and muscles involved in your body's movement. So, how do injuries happen? Most of us take for granted the intricate interactions of our bones, muscles, and ligaments until they are damaged. When injured, these tissues can degenerate, causing your joints to ache and feel stiff. Even ordinary daily movements such as walking and bending may cause a sports injury through overuse. Furthermore, the normal wear and tear on your body's tissue may become more taxing as you age. To prevent such problems, especially as you begin a fitness exercise, your sports medicine doctor offers total care. This includes X-rays to identify potential trouble spots. Afterwards, he helps you set an exercise routine that fits your body's present condition. Do you know your joints? Your body's most complex structural feature is its joints. Your joints allow you to grasp, twist, sit, and even feed yourself. Repetitive motions, however, may lead to chronic overuse of the soft tissue connecting bones at the joints. This overuse can result in injuries such as tennis elbow or even carpal tunnel syndrome. A more severe type of injury occurs when you lose your balance, thereby putting a joint under abnormal stress. Worse still, you could suffer a bone fracture. When a traumatic injury happens, effective medical care is crucial. Improper treatment of any joint injury can cause permanent loss of flexibility and reoccurring joint pain. As quickly as possible, the doctor applies ice packs to your injury. Ice deters swelling and inflammation, so you feel less pain. After keeping it iced for the first 48 hours after injury, the doctor begins therapeutic exercise of your wounded joint. Recently, a new treatment for degenerating joints has been developed, which is a product called orthokin. The treatment involves combining healing proteins with a sample of the patient's own blood. The injured joint then receives an injection of the mixture. This new technology stimulates our own white blood cells to produce large quantities of protective protein. Our cells make this protein naturally, but not in sufficient amounts to protect the damaged cartilage in our joints. It also has the advantage of convenience and lack of side effects. Here are some suggestions on how to prevent sports injuries. Use appropriate protective equipment. Maintain proper lighting in the training area. Have adequate rest. Avoid alcohol and drugs in order to prevent injuries. Follow a regular fitness training program to improve overall coordination and endurance. Better endurance will absorb pressure and prevent injury. Perform adequate warm-up exercises before training or performance. Avoid performing sports or work when you are sick. Most injuries happen when one is fatigued. Avoid treatment by dubious health practitioners. Use of inappropriate massage, adjustment and homemade medicine, often with steroids or other non-tested drugs, can cause more damage to the injury.
That is the end of Part 4.
You now have half a minute to check your answers.
Hi, this is IELTS Bob. I would very much appreciate it if you could like, subscribe and share this video, as this will enable me to help more IELTS students reach their IELTS goals. Very much appreciated. Thank you.